תשמע, ליד ברוריה לדעתי חייבים זה, ברוריה, ראית? הוא ישר נהיה רשמי בגללך.
הוא גם יודע להיות שני אנשים באותו מקום. גם זה כבר היה לנו. יש לו כוחות מאג'יק.
כתוב, טובים השניים מן האחד.
נכון. במיוחד שהשניים זה אתה.
עינב מחכה עד 6:05 ונתחיל.
נסגור עוד את האנשים ונתחיל. Well, I think we start with your permission. So hi everyone, and welcome to our sixth lecture as part of the webinar series we are holding. It's an initiative of a few organizations, Natan for International Humanitarian Action, Forum Bruria, Peace Foundation, Seed Society for International Development, the program in Tel Aviv University of Disaster and Emergency Medicine, Olam, and the Israeli Agency for Development and the Israeli School of Humanitarian Action. This lecture is being recorded, so after the lecture and later on during the week, we will send over through the social media the link where all of you can watch it and circulate it again around your network. This evening or today, depends where you are around the globe, we are having, at least for me, quite interesting lecture, which is being given by Dr. Bruria Adini and by Professor Mick Alkan. And if you let me, I'll read you briefly. I wouldn't say short, but quite interesting bio of both of them. And then we'll start with your permission. So, Dr. Bruria Adini is the head of the Department of Emergency Management and Disaster Medicine in the School of Public Health at Tel Aviv University. Dr. Adini has a PhD in Management of Health Systems. She's involved in both fields and academic activities, thus facilitates research of challenges identified in preparing for and managing varied emergency situations and implementing the findings so as to promote effective management of emergencies and disasters. Bruria is also involved in planning and implementation processes aimed at ensuring effective response to different hazards that pose a risk, including in studying, teaching, and validating policies. Dr. Adini previously served for 2 periods as a board member of the World Association of Disaster and Emergency Medicine, it's called WADEM, and currently serves as a board member of the local authorities confronting disaster and emergencies, science training encouraging peace, graduate training program, the National Forum of Emergency Management, as well as a member of the Israeli National Council for Trauma and Surgery. Dr. Adini specialized since 1987 in emergency preparedness and response of healthcare systems for mass casualties, events, and disasters. Bruria also served in the medical corps for 17 years, including 4 years as head of emergency hospitalization branch, responsible for the emergency preparedness of all general hospitals. For 3 years, Bruria headed the emergency hospitalization department in the Ministry of Health, and since 2000, served as a senior consultant of the Ministry of Health on emergency management. Dr. Adini directed on behalf of the Ministry of Health, Ministry of Foreign Affairs, as well as the World Health Organization, various trainings courses aimed at developing and enhancing emergency management competencies among healthcare personnel. Dr. Bruria researched various aspects of emergency preparedness and management, including risks perception, resilience, advanced methods of evaluating capacities, and utilization of social media in emergencies. I told you it won't be short.
And now
Yes.
I think there is a problem with the communication.
So I understand I'm not being heard quite well.
Yes, and also I think it's enough about me.
Okay, so it's enough about you. It was the cue to move to shift into Mick. If it's
Can you abbreviate my CV?
You know what? I cannot. I tried. I cannot. It's either I read it or you want to present yourself, Mick. You know, no, I'll do it for you. I'll do it for you. The guys will be patient because I think you are it's needed for them to know you. So again, Professor Mick Alkan is an MD specialist in internal medicine and infectious disease, Professor Emeritus of Medicine in the Faculty of Health Science in Ben-Gurion University, and former senior physician in infectious diseases in Soroka Medical Center. In the past, Mick served as a family physician, as the head of the Infection Disease Institute in Soroka, and as the chairman of the Division of Internal Medicine in Soroka Medical Center. Now, you know, Mick, I can abbreviate your bio if I just give the list of the countries you visited, and even then it will be quite long. Part of it is visiting professor places, participation as a team member in rescue missions, head of humanitarian missions, head of coordinator in educational missions, in various places such as Ecuador, Papua New Guinea, Kenya, India, Kyrgyzstan, Somaliland, Tajikistan, Belize, and it goes on, Congo, Louisiana, Thailand, Vietnam, and it's endless. It's really, really endless. Professor Alkan was also involved in developing health education programs for Ethiopian Jews in the Negev region, and in establishing a new medical school at Moi University in Kenya. Professor Alkan also has published more than 100 articles and chapters in books in the field of infectious disease, and his current activities are volunteering as an internist at the Open Clinic of Physicians for Human Rights, which he will discuss with us today about part of this his position there, and serving as a general physician at the family and medical practice in Vietnam, in Ho Chi Minh City, and as a team member on the Broad Hospital ship, which is quite a long word, in Papua New Guinea. And Bruria and Mick will go into discuss about this evening about the role and whether there is a role and responsibility of the state in accordance with the working with the migrants and refugees, and the tension, if it has or not, with the philanthropy and the civil sector. So go ahead, Bruria. After Buria's part, it will be shifted to Mick, and then it will be open to questions. The floor is yours.
Thank you very much, Einav, and I'd like to welcome everyone to our meeting. And I've said several times, this is going to be a lecture, and I certainly hope that that's not the case. What I'd actually like us to do is much more as a conversation of all of us, not only Mick and myself, but everyone that is with us this evening, because I think that together we have a wealth of knowledge, of insights, of perceptions that are the most important if we actually put it in one basket of together being able to look at the different challenges and the different tools that we have in order to make life that much better or that much more resilient for those in our population, those that live around us and with us, that are in a much more dire position than what we all are. Now, specifically, we wanted to focus on asylum seekers, on work migrants, some people that don't have any status, any legal status at all. And this is actually a challenge that we have been facing for many, many years, not just in the present situations, but because the coronavirus, the COVID-19 situation and crisis makes their status even more challenging and even more complex. This is why Mick and myself thought that it would be nice to, first of all, give some overview of data, of research, of numbers concerning these populations in routine, which the routine itself is very challenging, but also focus specifically on what is happening now during this COVID-19 crisis and how that aggravates even more their position and their status, and our role, the role of each one of us, not only the state and the philanthropy, which is what we're going to specifically focus on. So I'm inviting any of you that would like to comment or to ask or to raise a dilemma and so on. You can do so certainly when I'm speaking. You can either raise your hand if you have the camera, or put it in the chat and we will see it, and so that we will be able to also provide the floor to everyone. With your permission, I'm going to share my screen so that I will be able to show you some data. And I would like to start with what is our objective. The objective is to look into specifically into the health implications and the health response to other asylum seekers or to work migrants. I could have used many other terminologies and ways of looking into the population, and we'll get to that in a minute. And what we actually want to discuss today is, as I've said, the joint responsibility of anyone who can actually pitch in and be relevant in responding to their needs. So just to put it into context, when we're looking at our so-called routine way of living, not only right now when we're locked down in many places in the world, every 4 seconds, somewhere in the world, somebody is forced to run away from his or her home, lose the shelter, lose the safety of the way of life. And if we're looking at the overall numbers of displaced population, look at how many we're talking about. We're talking about almost 71 million people out of a population, the global population of something like 8 million people. So 41 million of them are displaced within their own countries, while almost 26 million have to run away from their own country and try to find some safe shelter in a foreign country. Regularly or most frequently, it's they don't have the same culture, they don't share the same language, many times they're unwelcome, and still they had to flee and find another solace. So I want to, for us to look together, who are the people who are actually taking care of them? And as we're focusing now on the governments on one hand and on the philanthropy on the other hand, I want to introduce you to some of the people, some of the stories behind the picture. So we can see here some of these people, they're asylum seekers, or as others would call them, infiltrators or work migrants and so on. Each time, and it depends many times on the agenda, we call them by different names, but each of them is an individual. Each of them has a story which impacts not only on his or her own life, but also on their loved ones, on the communities that they flee from, on the community that they run away to. So both the origin countries and the host countries are all impacted by their story, but we have to remember that it's one person and another person and another person, and each one has a world of challenges, of problems, of complexities that they have to deal with. So just to show you several ones, you can see Hagos here, a young man who ran away from Eritrea, arrived in Israel by crossing Sinai, was exposed to various types of tortures and ordeals while coming to Israel, and the same would be true to Bahabi or to Ksete and to many others, and I'll show you the pictures in a minute. But there are other people that also are involved in the story, and for example, we can see Zoe Goodside. Zoe is the director of the Department of Migrants and Refugees in the open clinic in the foundation of the Physicians for Human Rights, which Mick, which will also speak in a few minutes, he is one of the volunteers for a long period of time, was the chief physician volunteering to take care of all of these people who have many different types of needs, including medical needs, including legal needs to find shelter, to have someone advocating on their behalf. And we want to look into those pictures and how actually we can work together in order to provide for their needs. So when we look into those populations, who are we actually talking about, and who are those people who we can look into their being part of the situation? So we're talking about people who are foreign to the country. For example, if we're talking about foreigners, there's specifically if we look at Israel, because I don't want to look at the millions, because we tend to lose ourselves when we look at very large numbers. So in Israel, I have 200,000 foreigners that are not residents. Among them, for example, there are 67,000 tourists that they entered illegally, but then their visa has already been not valid anymore, and they're now considered to be illegally in the country. Foreign workers, some of them came with a visa, again, some of them without. We have foreigners that even though they're here illegally, or at least according to the perception of the state, of the government, are illegally staying in the country, but they cannot be exported, again, because their country of origin actually poses a threat to them. If they were exported back to the country, they may face torture or death, and according to the international law, they're not allowed to be exported. We also have those migrants that looked for a better quality of life, the asylum seekers, and those that were recognized as refugees. Refugees is a legal term, and only very few of them in Israel actually were recognized as refugees. So the refugees are the only ones out of all the people that I have shown you before and pointed to. They're the only ones that have a legal rights that, according to the international law, are entitled to education, to medical care, to other types of vital services such as shelter, education, and so on. All the rest, which don't have legal status, actually don't have a legal accessibility to many of the vital services. So what are the main challenges when we're looking for them? First of all, they need, when they're here, they need to be employed. They need to be able to sustain themselves and have the vital needs of food, of water, shelter, education, if they have children, and so on. Many of them who entered, especially those who entered through Sinai, were on their way victims of torture. There is the element of the compatibility and the compliance of the state to all the international laws and their legal rights and regulations and policies. Who do the state, for example, the Israeli government, recognize as eligible for medical care? Children, for example, are eligible because of the worry and the concern for public health of all the children in Israel, but the adults, in many cases, are not entitled even to the very, very minimal medical care. So let's look at the asylum seekers that were traumatized in Sinai and look at the numbers that we're talking about. We're talking about almost 33,000 people that are now still in Israel. 4,000 of them were victims of kidnapping, of torture, of human trafficking. On their way here, the average days that they stayed in Sinai was almost 28 days for males and 16 days for females. 41 of the males and almost 30% of the women were exposed to some type of violence. It could be beating, it could be kidnapping, it could be sexual abuse. And you can see the numbers concerning those who were actually torturers, and we can see the very large numbers of them. So I want to show the impact of that on their medical needs. So let's look at first on the mental health, on the post-trauma stress disorder. And if we look, for example, to those who were exposed to a beating or to sexual assault, or to other types of mistreatment, you can see the vast difference in their symptoms displayed of post-traumatic stress disorder according to their being abused during their way from fleeing from their origin country through Sinai to Israel. And we're talking, and look at the big difference between 1.5%, for example, those who were beaten, to almost 37%, or the same type of variability we can see of those who were victims of sexual assault. 36% had post-traumatic stress disorder versus only 2%. Now, if we look into the utilization of the medical infrastructure, which I'm sure we can all agree that this is a vital service. When we look at the ones who needed to utilize much more frequently the medical systems, we can see, for example, if we look at those who were victims of beating, 30% of them, of the ones who needed medical care, came more than 5 times to the clinic, compared to only 10% to those who were not beaten, or almost 50% of those who were exposed to sexual harassment, sexual abuse, assault, versus again 10%. So we can see that there is a very close correlation between the exposure to violence, to the need, and to the extent of need of medical care. So we can understand from that this is something that we, as a responder, regardless if it's a philanthropy or the governmental entities, we need to give a response to that. Now, we went even further, and this is I want to mention that this is a study that was made in collaboration with Professor Elkan, with the Open Clinic of the physicians of human rights. They opened their gates. They treated these people without legal status, and we together looked at the data to see what we can learn concerning the medical needs and the response that the medical infrastructure needs to provide. So, for example, there is a very close correlation between the time that we provide the medical care. If the patient comes to the clinic within the first 6 months of arrival to Israel, less than 40% needed medical care, not needed medical care, but actually showed post-traumatic stress disorder. But if they did not receive that medical care in the first few months and only came and approached the clinic a year and a half later, more than 40% of them had these clinical disorder, which of course are then correlated to not only their own suffering, but the medical aid that is needed to be provided in much higher frequencies. So when we're looking into the needs of the health consequences of these populations, we see there's impact first on the population themselves, on the patients. They don't have accessibility to medical care except for emergency medicine. If they come to every hospital with something acute, they will be treated. But other than that, they will not be treated, not for cancer, not for diabetes, not for high pressure. And then when they get to the hospital, they're usually in a much worse state. There's a lot of damage also done to the medical infrastructure itself. Millions of Israeli shekels are actually not being reimbursed to the medical infrastructure because they don't have medical insurance, the patients. And so again, they treat them when they come for the emergency care, and there's a lot of revenue that is missing. And there's also ethical issues. What do you do as a physician or even as a director of a hospital when someone calls you, like Mick calls you and says, well, I have a patient who is in a very bad state because of cancer that has been already metastasizing. Can you actually say, no, don't bring him, don't send him? This is a big ethical issue. So where does that come into effect between the government and the philanthropy? You can see all of these different response that is needed by both the philanthropy. For example, the first clinic was the Physicians for Human Rights. And we can see, you will see in a bit later that I will show you that in 1998, that clinic was actually opened. Only 10 years later, a decade later, the governmental clinic, which is run by B'Terem on behalf of the Ministry of Health, opened, and only 6 years later was there another clinic that was first run by a philanthropic society in collaboration with the Ministry of Health, looking into the mental health needs of these populations. So when we look at the connectivity between the philanthropic bodies and the government, the philanthropy are usually there first. They recognize the needs. They want to provide a response. They volunteer, as Mick has volunteered for many, many years. We see here Professor Walden also in the clinic, but there is a ceiling that they cannot go above. There is a limit to what they can do. And then we need also the state. For example, you can see here the laboratories or the ultrasound services that are being provided by the state, but it took them much longer to be there, to start and provide these services. We also want the philanthropic bodies to actually be as acting as advocates, to change the policies, to sometimes even not only encourage, but force, make a lot of, let the voice be heard that there are policies that should be maintained and should be put in place in order for these asylum seekers or the migrants to be able to receive their essential services. So there is a role for the government. There's a crucial role for the philanthropy, but there's also a role for all of us, not only concerning the providers, also concerning those weak populations. And if you ask me, what is our role? All of us, each one of us is here. It's to make sure that these people are not invisible. We need to see them. We need to be part of the response. We have to make sure that they're not alone, that they're not lonely, that they're not uncared for. And this, all of this was even before the coronavirus. It's even much more complex during this crisis. And I would like now to ask Mick to continue from this point on and help us all understand how the situation is even more aggravated during this present crisis.
Thank you, Bruria. Can you please turn the slideshow off? Yeah, thank you. So what I would like to concentrate on today is actually very simple, because I think Bruria convinced us that in the best of days, the asylum seekers and refugees and illegal citizens in Israel are in dire straits regarding their health. And then came Corona, which adds another aspect of fear, of worries, in the absence of any organized help. So the bad news is that the status of these people, their personal hygiene, their density in living conditions, their nutrition, and their healthcare are all lacking. So they are at high risk for any kind of epidemic, let alone a contagious disease like corona, which really could devastate a community like that. The good news is that this population is actually a very young population. It consists of young parents and children who actually carry a very low mortality in spite of being very good transmitters of the disease. So we don't anticipate a lot of fatalities or seriously ill people, but the epidemic is there, and we are now at a number of about 15 diagnosed patients from among the stateless people in Israel. So who is there to help? Actually, it is the NGOs. It is the third sector which really pitched in first in translating the orders of the Ministry of Health into many languages and making them accessible and available to this special population. And to my amazement, the local government, the mayors of towns like Tel Aviv and Eilat, really came to rescue and help, which really I find amazing. And more recently, it is very clear that human hunting season is over. The police is busy with other jobs, and these people are now not really afraid of being deported forcefully like they were before. There might even be a ray of hope where there will be new openings for employment of these people in jobs that might be free now, unlike before the epidemic. I will stop here and be happy to answer more questions.
Thank you, Bo and Mick. So the floor is open for questions.
Sorry, it's me, Jack Tigitigi, one of Silent Seeker, and I truly appreciate your efforts, Bruria and Nick and everybody who took part. Yep.
Yes, I'm not sure. I'm not sure whether it's only me, but I think there is a problem with your microphone. So if you can, I don't know. I think there is an echo. So if you can find a solution for that, it will be great.
Now you hear me?
Come again?
Now you hear me?
Better now.
Let's try. Yes, it is better.
Again, I am Jack Tigitigi, one of the refugees from Darfur. And I just want to say that I do appreciate a lot your effort, Bruria and Meg and everybody who contributed for that. And one of my questions was, still I don't understand whose responsibility to take care of refugees, especially with the coronavirus. I know in, how do you call, like three people or anthropologists, people who are doing like Bruria and Meg, they already do without even somebody telling them that this is your role or not. But I don't understand how government has the responsibility to take care of this issue, and until now, I haven't seen that clear clarification. I know indeed maybe some local governments they do some stuff as very slight, but I don't think that is lawfully or they have obligation to do that. They can do according to what we can do, but that is very, in certain extent, and not very at the level of the government.
Go ahead, Mick.
The response of the Ministry of Health to this epidemic has been, like the response to any epidemic, is to isolate the sick people and prevent them from infecting more people. So these 15 identified cases are either confined to their home, which usually will infect their surroundings, or they are hospitalized where they are isolated so that they don't infect anybody. So far, the increment of people who are positive for corona in this population is very small. And I'm talking 3 days after a testing site has been established in the old central bus station of Tel Aviv, specifically for this population.
I want to add something. The medical issues here are part of the public health concern, and naturally, it doesn't matter who may be contracting the disease. The government and the Ministry of Health is interested, of course, in finding all of them so as to limit the spread of the disease. But the challenges are much wider than these. We know of a huge unemployment problem as a result of the lockdown, for example. So the question is, who is now taking care of all of these populations concerning these challenges? Okay, now if we're talking about specifically refugees, and I said before, refugees are only a very small part of the population. They have the right, there's legal rights under the international law and so on. But all the other people that are without these legal status, the problem is much worsened. And here we're still, in my opinion, far from having a good response. Part of it, at least for the workers, for the foreign workers, the government is trying to make some concessions, such as, for example, there was a decision made to allow them to withdraw some of the money that was put aside as part of the deposit that was actually before this corona crisis was put aside for them to be used when they're leaving the country. So there was a concession allowing them to now take part of that money and use it for regular needs, to buy food, to buy the element medications and so on. But as I've said, the challenge is much wider than just the medical one. And again, I don't think there's a very good solution for all the populations. And it takes, in order to make life a bit more dignified, it needs to be a collaboration between the government and the civil society organizations. One element by itself does not provide the full answer.
Thank you. I see we have 2 more questions. If you can see it on the right-hand side of the chat, or the question of Janet, and I'm reading it out loud. So Janet is asking, is there something that should be done right now that is not being done for this population?
Mick, you need to unmute yourself.
Yeah. Mick, if you're talking, just please unmute your mic. Not yet. Mick?
Here I am.
Yeah.
I don't think that the corona epidemic poses more issues than every day regarding decisions that have to be made regarding these people. Some of them have been in Israel more than 10 years and they are in limbo. So the situation basically is dire and very sad. And what we really need is a decision that was once for about 4 hours made by the government and then withdrawn to resolve the issue basically and give them the right to work and to live in Israel at least for a limited time.
I completely agree with Mick, but I also want to take it a bit wider to each one of us. I don't think, and I completely agree with Mick, that the issue didn't start with the coronavirus, but maybe this is also an opportunity. And we always need to look at each crisis also an opportunity. And the present crisis is maybe an opportunity to also advocate on the needs for these populations that are here with us. They have children. They need the basic rights. that's something that all of us, not only the ones that work in the foundation, in the civil society organization, but each one as a citizen, as a resident, as a human being. Yes, we should highlight that they're among us too, that they have the same needs as we all do, that we need to take care of their needs in shelter and education and a decent way of life, and advocate for them being part of our society as long as they're here with us. Okay, now do you want us to address
Yes,
the second question?
Yes, if it's okay, I'll read also the follow-up question asked by Alon. Alon is asking, taking into account asylum seekers, as the rest of the Israeli society, are probably postponing necessary medical treatment, how should NGOs or others should prepare for post-corona era? Great, good question. Do you think that there is anything that can be done now to prevent a difficult situation, or maybe I will add, I'm not sure prevention, even mitigation in that sense, or harm reduction, it will be great. So if you can relate to that.
I want to give as an example the response of the Israeli Ministry of Health to the question of HIV carriers and AIDS patients among this population. They were offered free treatment and follow-up, not because of humanitarian goodwill, but because of issues that have to do with public health. Understanding that any epidemic in this population will spread to the rest of Israel. The same thing was done by the British government since the 20s of the 20th century in establishing very good childhood immunization systems, because they understood that immunized children will protect the Brits themselves and their children. So I think that the corona might be a red light for the government, and that rendering healthcare and providing medical care for this group of people is beneficial to public health in Israel.
I would like to say something more general, that specifically just looking at the post-corona concerning the medical needs of the asylum seekers or the work migrants. I think that, again, from the same perspective, that a disaster or a crisis is also an opportunity to do something better. And this is maybe nature is calling for all of us to try to look at life in general. We need to understand the respect, the deep respect of mankind and mankind versus nature. We're all sharing their environment, we're sharing the resources, we're sharing our social systems and so on. If we want to be more resilient for the future and not live from one lockdown to another lockdown, then most probably we need to be, all of us, more sensitive to the needs of others that are very close to us geographically and so on. I would like them to be also more close to us as community-wise. And maybe this is a good opportunity to relate to something that Alon Bar said before when we began, that now again, under this umbrella of collaboration between many entities, both governmental entities and civil society organizations, we have initiated a very large-scale survey that went out today to the different NGOs and organizations, civil organizations that work in low and mid-income countries, looking into their needs, the gaps, what they would actually expect in order to facilitate their continuing work during this crisis in those communities. And we would like to invite all of you to share the link of this survey and encourage others that you're in contact with to actually provide us with information, because the real purpose of this is to understand the needs and the gaps, and accordingly to be able to facilitate them so that the work can be done much more efficiently, so we can together achieve a better response.
Okay, great, thank you. Any other question? Yes, I see that Or is asking a question. Are you not afraid that by emphasizing the need of migrants and asylum seekers, you will spread fear that would backlash of these communities, and that they will be viewed as health hazards and calls to deport them will strengthen? Just this week, Saudi Arabia starting deporting Ethiopian migrants from its borders, which is an interesting question. Do you have anything?
First of all,
I see face nodding. Yeah.
first of all, you're right. This is a challenge, and one of the elements, one of my I don't want to say criticism, because I don't want to criticize anyone. I want to come from a good position. But one of the challenges that I find with the risk communication that we're receiving during this COVID-19 crisis is a lot of fear. We're saying there's not going to be enough ventilation machine. There's going to be so many people who are going to die. The fear is instilled in all of us. The message, the real message is that together, we actually have a lot of elements, a lot of activities that we can do to protect all of us, to make all of us safer. And this is the same message that I think needs to be out there concerning all of us. And certainly also those populations, the vulnerable population that we're talking about here. Right now we are fearing, for example, to be in contact with our parents, right? Because they may be ill, because we may, they're a vulnerable population also. And if we meet them, I haven't seen my daughters. I have 2 adult daughters. I haven't seen them almost in a month, because again, they're afraid to come. Maybe, you know, they will inflict some of the risk to us. So we need to work on the understanding, on the solidarity, rather than fear. And I believe in humankind, and I believe in people. If we get the message across, we will do good thing, and we will achieve good results, and not just instill the fear and getting the worst result of just people wanting to deport them.
I think, if I may add, it's addressing the issue of stigma, or we see, Bruria, you mentioned ageism, right? And we just saw how we've reacted to part of the. I know that I've read some comments on the Haredim, on the Orthodox, that they are spreading the disease, right? And we just heard today that the anti-Semitism is rising its head in France and in England, because Jews are they are in a higher rate of mortality because the way they live in England or in. So it's in that sense, it's fighting the stigma and the racism as a whole. And I think that a person or a society which is racist, it's just another excuse to its racism. In that sense, I'm not sure whether expressing, okay, listen up, guys, we have a ventilating machine for everyone. It's the whole response, but it's something that should be, or maybe it's, as you said earlier, Bruria, to use this opportunity for education, to see how all of us are human beings. But then again, if you're racist, you're racist. If you are conceiving the elderly with hatred or with stigma, with ageism, it's a different matter. But maybe solidarity will work here as well. But this is only from what, you know, my wishful thinking on that sense.
I would like to add that any epidemic, from the plague in the Middle Ages up to now, provokes xenophobia and the hate of each other. Just as an example, I had to cross 3 airports on my way home in January from Southeast Asia. You should have seen how many vacant seats were around anybody who looked Asian. And you have mentioned already the extreme Orthodox Israeli community, which is now ostracized. It is not an easy task. And I think that we should all really learn from this and try to educate people against this kind of racism and xenophobia?
I think that we all in this in this conversation we all agree. I mean, we're on the same side, right? I think we are preaching the converter. I think is the English term. But I know a few people who are the lecturers that have more access to the I don't know, to the government. So maybe you could put a word there. I don't know. Just an idea. Any other question? Any other comment, Bruria, Mick, that you'd like to add before we are closing it down?
I was just, it's me again, Jack. I'm sorry for coming back again and again. I have a question to you guys that you are working in the field of mental health issues and stuff like that with refugees. And a lot of refugees, they have a lot of fears sometimes when it comes to the services regarding psychological issues that they are receiving. And I know that the numbers that you brought there about people who are in need of social psychological assistance, yeah, it is a lot, but according to the total number of people who are in need, it's still very little. If you experience anything like, you know, the fear that people are not trying to go to the treatment and people are not fast a lot on the treatment and stuff like that. And I will just include with you that yesterday when the state came in South Tel Aviv and they were trying to check cases of corona, and a lot of people were speaking, oh, what the state is going to do for us now. They are coming to separate us from other citizens, and they are now making a lot of special places for us if maybe something bad is going to happen, something like that. Anyhow, generally, I was speaking about the fear of refugees regarding to the trust and stuff like that. If you experience something like that.
Einab, you're mute.
I had a problem to hear the question, if I may say.
You didn't hear? Okay. I was speaking.
Also, it's on my side. I wasn't sure whether it's on your my side. Is what I was asking.
Yeah, Bruria, did you hear Mike?
No, I couldn't understand
No, I
either.
could not make it out. Could you please write this briefly on the chat so that we can read it?
Okay.
Mick, do you know what is the situation in Europe now with people in the same situation?
No, I don't. And there's no talk in the WHO or local public health bulletins that I'm reading very carefully every day.
And that's also part of the problem, part of trying to not look at this population and understand that they have the same needs as all of us.
Sometimes even more.
Right? Right.
By definition, more.
Jack, are you writing your question on the chat?
Here, Jack just added. How do you manage with refugees regarding those who are in need of help, but they don't trust the authority or other bodies? This is a good one.
Very, very good point. I think that the people who are statusless in Israel need to realize that this time with Corona, they are in less jeopardy from the authorities. I don't think that there can be any deportation because there are no flights out of Israel. I don't think that anybody bothers with that right now. So for them to find some kind of employment just to get enough to get by and eat and have food for the family for these trying weeks might be a possibility rather than in regular days when they're almost afraid to come to Terem Clinic even.
But again, this enhances the need of philanthropy to also be involved, because they instill much less fear than the formal entities of the government.
Does it respond your question? Yes, it is. Any other question? Okay. So with that, I think someone wants to ask one question.
Einav.
Dr. Tal Hanani, how are you?
Hi, thank you, Bruria and Mick, very much for this really important session. I just thought maybe it should be worth to maybe take some inspiration for the end from Portugal, who just a week or a week and a half ago declared that they're gonna give all asylum seekers and immigrants who already started the process or applied for process for refuge, a policy of full rights, exactly like the residents, permanent residents, which means healthcare, full healthcare, social networks, financial welfare benefits, etc. They have almost, if I'm not mistaken, 600,000 of refugees. So not all of them are going to get it, but they already started doing that. It's a whole logistic procedure and challenging, but I think this is worthwhile looking also, and maybe for the governmental official here to listen. I don't know if something will happen here in Israel in this regard, but it's definitely, as Bruria said before, an opportunity to think about this kind of crisis and how we can handle them for these vulnerable populations. So yeah, I will try to put the link for the Portugal situation. So thanks.
Please do, if you can send it or through the chat or later on through the email, and we'll circulate it around whoever missed this discussion.
Sure.
Great. Further comments before we're closing down? It was again. I had the privilege to listen to Bruria and Mick. I'm not sure how many times, and I'm learning again and again and again and again. Thank you, Bruria and Mick, for your, as Tal said, your really interesting and important facilitating the discussion, because I was trying now not to say lecture, you know, Bruria. I failed. I know I failed, but I tried my best, you know, as always. We are going to have our next lecture next week. In the 20th, we will publish it. It will discuss geopolitics within the Middle East regarding, of course, the corona. It will be delivered by Miri Eisen from Forum Dvora. Follow it, and we will send it over. So thank you again, and in that context, Modim Simcha and Chag Sameach to whoever is celebrating it. Bye.
Bye, everyone.
Bye, thank you.
Good evening, and thank you, Einav, for the facilitation.
Pleasure. Bye-bye.
Bye-bye.